I see children who don't want to put a toothbrush in the mouth because toothbrush feels like sandpaper to them. It's not only targeting to the teeth, it is targeting to your brain as well as the gut. So that is all related to behavioral issues. If oral hygiene practices are improved, speech is also improved. My parents come and tell me ki ma'am brush to করতেই চায় না তো আমি তখন একটাই কথা বলি ব্রাশ করতে চায় না একদিন তো বইও ধরতে চাইছিল না আজকে তাকে তো আমরা বই ধরালাম
Hello everyone, welcome to India Autism Center podcast, the platform for meaningful conversations and discussions about neurodiversity, autism care, community awareness. So joining us today in the podcast is Dr. Madhuchanda Palit. She is a pediatric dentist who has very beautifully amalgamated pediatric dentistry with autism care. So over to you, ma'am. Please give a brief description of your professional journey and how did you come up with autism care?
So basically I am an exclusive pediatric dentist. I have been practicing for past 15 years now. Autism was when we were studying. So that time autism was always like it was close to my heart, something which was developmental delay or special need. Later on I moved to UK. When I moved to UK, I really got connected to autism. And through there, my journey with special need have started. I saw the practice in UK, and when I came back here in Kolkata, I started practicing. I wanted to incorporate it in my practice as well. So that is how I started, my journey of autism has started.
So ma'am, this integration of dentistry into autism care or, individuals with, in the neurodevelopmental disorder spectrum and they are having a lot of dental problems as well. So how do you relate your journey to this? Are you liking it?
Yes, definitely, because I always wanted to work with those children because I have seen during my journey, because a special healthcare need is not much, very well spoken in India. Right now, it might be, but at one point of time, it was not. And even if it is more of the behavioral part which we are concentrated on rather than the dental part. And so when I started with working with children with autism, definitely I too had my sort of challenges. It was not very easy. However, with my practice of 15 years now where I stand, I love what I am doing right now, because the service which I am providing, that's what my patient speaks for and the parent speaks for.
And it's beautiful to see them evolving.
Yeah, sure.
That's so ma'am, coming with a basic question, what are the common dental care problems that children with autism they face?
That's a very important question, I would say, although a basic question. So the first and foremost, it is oral hygiene. So the children with autism definitely have a very poor oral hygiene that might be related to their sensory issues, which they have. Also their motor coordination delays. Some are hyposensitive, some are hypersensitive. So second, what we see is bruxism. They have night grinding or grinding of their teeth during the day. That causes wearing of their tooth. The third one which we see is pica, which we call, which is like they eat non-palatable items, non-eatable things which we don't eat. That again causes problem to their oral cavity. They also have self-injurious habits. I have seen children who are actually, they are stripping off or picking their own gums. They are also biting their cheek. That is another problem. Dental caries, if we call. So dental caries is also more, but it's not because of autism. It is because of their restricted food habits, which I have seen. They are more towards sticky foods like carbohydrates. That causes. Also, they have malocclusion, which comes at the end, delayed eruption of the tooth. See, these are the common problems which I have regularly seeing in my clinic. Most common of them all, which I said, is the oral hygiene.
And ma'am, it varies between, like, is it these oral hygiene problems or rather the self-stimulatory problems, it decreases with age without intervention?
Again, see, autism is a condition and every child is different. We all know that. So it is more what we asked is that I have children who have improved with age, who have come to us. We have done something on them and they have improved. So early care is really needed. Early intervention is needed to develop a good oral care habit for the children, because we are not looking at the child at the particular age when we are seeing them or we are getting diagnosed. Ultimately, our goal is when they are they are an adolescent. That's the age we are looking for when we are not there to help them out. So it's a behavioral practice, I would say. Rather than dental care is a luxury, I would say that's a behavioral practice that has to be developed at the very early age.
Ma'am, very insightful, even for us, and I know definitely for the parents who are watching out there. Ma'am, saying this, as far as I know, oral care is beyond teeth. It's not only regarding the teeth, and like you mentioned, gum. So, ma'am, if you can, very lucidly explore and say, what is oral hygiene?
Very beautiful question, because oral hygiene, when we speak, it is most of the time only teeth. However, it is not teeth at all. It is a holistic approach to our children. If we see oral hygiene, the cavities, our children, they have, or the children with autism, they have communication problem. So if we see the behavioral part, if they have a communication problem, they have we see parents, they are they have behavioral issues. There is change in the behavioral issues of the children. They are showing more meltdowns, or developmentally they are regressing, I would say. All of a sudden, they go to different specialists. However, it's a very simple problem of only a pain in the tooth, which they are not able to communicate. So with that, actually, we can, their developmental issues can be sorted out. Again, we see gut and brain connection. Gut and brain connection, if the oral cavity, it is the gateway to the gut as well. So when we are taking care of the microbiome on the inside the oral cavity, studies of Ames as well as Nimhans, they have also said that. So the oral cavity, the microbiome, they are not only inside the mouth, they're traveling to the gut as well. So what are they doing? They're changing the gut microflora. So at the same time, if there is change in the gut microflora, that is again related to their behavioral issues. That is how the gut-brain axis is connected. Also the immune system, I would say. The first immune system primarily is the oral cavity. So the immune mechanism is also starting in the oral cavity. So if the oral part is taken care of, the whole holistic body approach, like I would say the behavioral approaches, it's not only targeting to the teeth, it is targeting to your brain as well as the gut. So that is all related to the behavioral issues. So it plays a very important and the major role for the development of the child.
So, ma'am, dental care, that is in our society as well, even for our kids, we do not emphasize on dental care. Like they're having brushing and all, they are doing it. But we are more careful towards their physical thing if they are having a stomach upset or regular doctor checkup, right, ma'am? So even in autism, it becomes very important, these milder things, because children, they are not able to express. So, ma'am, can you please suggest us some red signals or common indicators that the child is having problems in oral hygiene or dental care? Maybe the child is not able to express or the parents are not able to see. So, just ma'am, if you can elaborate on this.
See, I have seen a child who had come to me, and he had a lot of self-injurious behavior. So the parents, first of all, they took them to a occupation therapist and to a speech therapist, that what is the problem which is going on, to a behavioral therapist. And then finally, from the behavioral therapist or the OT point of view, we were referred to. That was maybe after the child already had some aggressive issues, all their behavioral issues. And then when we saw, there was a lot of dental caries in the child tooth that was also in a permanent molar region. So what was the child's perspective? They had been looking for every sort of possibilities other than dental caries or other than the importance of the mouth. Okay. So when we treated the child, okay, we have seen tremendous improvement in the behavioral change, and there was behavioral changes of the child. The child who had regressed, the child was non-verbal, I would say. The child who had regressed, he actually started behaving good in the school as well. Okay, so that is the importance of dental caries, or I would say that is the importance of oral hygiene practices rather than only dental caries. Oral hygiene practices in the patients with autism, especially because of their behavioral and the communication problem, because they're unable to express their pain. So that is like, shown in some other behavioral ways.
Very insightful, ma'am. Ma'am, related to this, we know sensory processing disorder.
Yes, they have SPDs.
Right? So even for children who are having, they do not have prominent symptoms of autism, but they are diagnosed with sensory processing disorder. So even do they have problems in oral hygiene and dental care?
Sensory issues are many a times related to oral hygiene and dental care. Why? Because oral cavity is a highly sensitive area, I would say. And neurodiverse children, some are hypersensitive, some are hypersensitive. I see children who don't want to put a toothbrush in the mouth because toothbrush feels like sandpaper to them, I would say. Okay. And there are some children who seek more, more responses. So more sensory input, their proprioceptions are very heightened. So what they do, they are chewing on the toothbrushes. So that someone is not even want to touch the toothbrush to someone who has been chewing on the toothbrush. So I can't say that is a targeted approach to the parents, because one particular, therapy or a dental therapy, I would say, will not work for all the children. A child who is not brushing, who is chewing on the toothbrush, that child should be given a chewy tube first, so that he is able to chew and his sensory inputs are taken care of. Other chewable things. A child for whom the toothbrush feels like a sandpaper, we can introduce a silicone toothbrush to them, which is softer. Some children have, problem with the toothpaste. That is the reason that sensory issues, the SPDs children, they have problem with the toothpaste. So the problem can lie from their sensory issues. The problem can lie either in the toothbrush or in the toothpaste. So if we have to start changing the toothpaste and exploring. Usually children who have sensory processing disorders, they prefer mild toothpastes, which are non-flavored toothpaste, either they are gel-based, sometimes Ayurvedic toothpaste as well. So autism or this sensory processing disorders, they have a lot to do with the oral cavity, and a very mild toothpastes with sometimes I would say the battery operated toothbrushes, which are power brushes, which have a very mild vibration. They can also act for the children with autism. It's a very explorative field where it's been very child specific, where we have to target and see what is the, I would say, the sensory profile of our children. Through that lens, we have to see the oral care.
This was for the parents. So they will also appreciate how vividly and how nicely, the different aspects of the dental care, keeping in mind the individual concerns of the child, that is being kept in mind and done. So this is also a kind of intervention, based on at times trial and error practice. So ma'am, coming to the next question. So when we say early intervention, it begins as early as, 1 year, 2 year, whenever we see that the child is at risk. We usually suggest for occupational therapy, speech therapy, behavior modification therapy, play therapy, special education, nutrition, this, that.
They play an important role too.
Right? But ma'am, dental care, that is at times not mentioned. Maybe the parents, again, through referral of some specialist, they are, going there. So ma'am, can you please explain? You have earlier done that, but this is for the parents even, so that even they understand, and other professionals. How do we incorporate dental care, and how important is it in the early intervention of the child?
Prevention is the cornerstone of pediatric dentistry, or in fact dentistry, I would say, because all the diseases of dentistry, they are highly preventable. Be it dental caries or gum diseases, if they are caught very early, they can be very easily prevented. So what are we achieving in case of prevention for our children with special healthcare needs or autism per se? I would specify on that. So autistic children, they love predictability, they love structure, they love routine. When we incorporate early the dental care for such children, what happens when they are coming, there is nothing which is not very much, a surprise to them. They are already structured to that particular dental practice. They know the team, they know the outcome. So what they are achieving when they are coming to a dental practice where they don't have a caries. They are not already in a pain. They are just coming for early intervention. So what are they achieving? They are achieving a positive outcome, that they know that they have come, they can see, walk around the office. They know the different heightened stimulation because they are overwhelmed by the dental atmosphere itself sometimes because of their sensory needs. So they know they came, they just sat on a dental chair, nothing was done to them. They were only the checking of the oral cavity, and they were given with a positive reward, which we do. We token them with a stickers or a small gift. So that is for the children part. So now brush also from the parent part or the caregiver part for the early intervention. If we start very early, they get a help for how the toothbrushing should be taken care of, because for many parents, toothbrushing is a regular hustle of their daily routine. So what are the children, I'm very sorry to say, I get many parents who come to me and say that they are in a guilt, that they never knew that the behavioral aspect was all because of a simple dental caries. They never knew that. So if they come early, we train them or educate them how to check that. We do it for them. And so that is giving them a very much, power to the oral care of their own children. That is the role of early intervention, because the child is also in a positive setup and the parents are also knowing how to go ahead about it. So every 6 months, they just come for a regular follow-up. That is what it is done. And also they will have, we sometimes do like train them how to massage their gums as well, how to introduce brushes to them. So everything is taken care of for every 6 monthly visit. That also reduces the burden of the care that can arrive if at all any problem arises to the child. So that burden of care is also reduced at every particular visit.
So, and in a way, like you said, it also leads to emotional, physical, and overall well-being of the child.
Yes.
It adds
Absolutely.
a major contribution.
Absolutely.
So, ma'am, you have visited several dental care institutes in Kolkata and across.
Yes.
So, what would you recommend, or what would you say are the prerequisites of dental care units that are autism-friendly?
Actually, what I would say is an autism-friendly dental clinic need not be having a very big infrastructure, need not be having, a beautiful or a very expensive machine which we put overnight and we make it autism-friendly. I would say autism-friendly dental care starts with empathy first. Not only the dentist who's taking care of the child, but the dental health team, the dental assistants, the front desk staff, everyone should be knowing and understanding what autism is. What is the meltdown? They should understand that behavior of the child is not because they are misbehaving, it is how they are showing off their distress. And also, what we can do is, what we do in our clinic, we have a sensory corner where we say it as a happy corner for the child, where we have incorporated a bin bag, where we have incorporated a mat for the children, some fidgety toys that gives them a lot of comfort or away from their discomfort, or it's like a home to them when they come to us. Dental clinics, as I have mentioned, they have a little bit of more, it's a sensory overloading exposure, I would say. So simple incorporation of dimmable lights and white noise, which we called small soft music playing, or noise cancelling headphones can be used. We can also transform the operatory with some changes in the lights so that the sensory integration is taken care of. We have a wall in our dental clinic which takes care of different types of sensory needs of the children. So if they are overstimulated, they can feel at home. We have a galaxy room where they can stare while getting their dental treatment done. Also sedation. Sedation plays a very important role. So these are very subtle and small changes that can be done in a dental clinic to make them autism friendly, I would say. But first and foremost, it's never about the infrastructure. It's about the knowledge of the professional as well as the team. They should know what autism is, what are the behavioral changes, what the parents are expecting. So it's empathy for the comes first. Later on, the changes, small changes that we as a professionals do in a dental clinic.
So, ma'am, the entire picture, it was very vivid in front of my eyes. I wish I would love to go to your center because that will also be something empowering for me.
I would love to have all of you there.
Yes, ma'am, sure. Ma'am, a very common problem that children with autism they face, the parents report is teeth grinding. It at times becomes very distressing for them. So, ma'am, can you kindly let us know the causes of teeth grinding, the triggers, and what are the practical home-based strategies that can be implemented?
Bruxism is multidisciplinary, the management of bruxism, I would say. Parents, they can first rule out what is the cause of the bruxism, what the child is going through. Because bruxism is nothing but grinding of the tooth. So it can be it can have a sensory component to it. So sensory component means the child is doing it because of some neurological issues, or the child is at stress, or the child is at anxiety. That can lead to bruxism. And bruxism can also be related to the children who are seeking some sensations. So with the grinding of their teeth, their sensory overload, or that is a stimming behavior which is giving satisfaction to them. These are the causes of day bruxism, when the child is bruxing in the daytime. So for the child who is bruxing during the day, as I said, the sensory profile of the child, what is it that is making them do it? If it is change in the school, or if it is change in the class, they can go to a behavioral therapist or a psychologist, clinical psychologist. If it has a neurological component, they have to go to a neurologist to check into that. Sometimes day bruxism is also related to malocclusion of the tooth, where the tooth is misplaced. It's not placed properly because of some other reasons. And dental caries can also lead to bruxism, which is giving them a soothing behavior. So those are day bruxism. They need to come to a dentist for that. And for night bruxism, what I would say, night bruxism is mainly taken care of by the professionals. Night bruxism, we provide mouth guards. Again, I would say the treatment of bruxism is always with the management, I would say, is always non-invasive. Mouth guards come at the very last end for the children who are really desensitized for it, who are cooperative, and who are in a not very young children. So the management of bruxism first starts with palliative care, where the children, the sensory profile first. Second, providing them with something to chew on, the chewables other than toothbrush or whatever they are chewing on. Third part is to take care of the circumstances. We cannot change the child. To take care of the circumstances, what is causing it in them. And then comes the professionals who comes into picture.
Okay, so this is also very important, and we know teeth grinding, we usually call it teeth grinding, that creates a distress. So immediately the parents, they should visit.
Yeah, I forgot gut issues. Many a time gut issues can also lead to bruxism.
Okay.
So that gut issues has to be taken care of. So these are the simple causes due to which bruxism comes into picture. And last is we can do some managements. If the tooth has broken due to bruxism, then we can take a major role onto it. Massage can help. That I missed the part. There are certain massages which the OT can help, or dentists can also help, pediatric dentists. The massage of the gums help in autism, bruxism, I would say. And also there is power toothbrushes, as I mentioned, massaging the gums with a very low vibrating, always consulting with the OT. Weighted blankets, they helps many a times, because we should know that how the weighted blanket is giving a perception to the child, so that his bruxism will also go away.
Okay, so
it is connected.
So ma'am, occupational therapy and this dentistry related to sensory processing problems, both are quite interconnected.
Absolutely. We work with hand in hand with the OT.
Okay. So ma'am, some practical strategies for parents. I know even they are, willing to understand some strategies that they can adapt for the dental care of children at home.
I would say start early. It is a very crucial and a very important part for the overall development of the child, for the behavioral issues of the child. So, starting early is the key. Being consistent with the dental routine is the second key. Brushing, which was, I have seen parents for whom brushing once was a very difficult situation. Child holding the brush was only difficult. 3 years later, that has transformed into a child who is brushing properly. That was only because they were with the routine, because our children love predictability and the routine. So consistently they have done it. So that is the first. And again, let the child be at the apex and the parents in the both the corners. So let the child take the control of the brushing techniques of or what is the child actually preferring. As I have already mentioned, what type of or the color, they are very like particular to the color. So we can take the children to the stores. I know it has its own difficulties, but we can take the children to the store, show them the toothpaste and tell them which color do you like. And then they can choose. So we are giving the control to them. So intervention, dental intervention of a child with autism, with communication delays or with sensory processing delays and with behavioral problems always starts at home. So that's the primary intervention. So how does it come? It comes with a proper routine. It comes with consistency. It comes with discipline. The very first, it is not only about, holding the child, and the goal is not only to clean the tooth. The goal is to clean the tooth efficiently in a very non-traumatic environment where the child is also happy and it is not a load to the parent. And it doesn't come in a day. It will take time. There are parents who are unable to. They might think it's easy to say. However, I have seen how easy it is when we are doing it consistently. As my parents come and tell me ki ma'am brush to করতেই চায় না, তো আমি তখন একটাই কথা বলি, ব্রাশ করতে চায় না, একদিন তো বইও ধরতে চাইছিল না, আজকে তাকে তো আমরা বই ধরালাম, একদিন পটি ট্রেন্ড ছিল না, সেটাকে আমরা পটি ট্রেনিং করলাম। তো কেন করতে পারলাম? কারণ আমরা জানি পটি ট্রেনিং এর ইম্পর্টেন্স। যেদিন আমরা বুঝে যাব হোয়াট ইজ দ্য ইম্পর্টেন্স অফ oral cavity and the oral health in a general health of our child, behavioral health of our child, আমাদের বাচ্চারা ইজিলি ব্রাশও করবে। একদিনে করবে না, টাইমলি করবে, টাইম নেবে। মেবি প্রতিটা বাচ্চা হয়তো যদি 2 বছরে করে, আমাদের বাচ্চারা 4 বছরে করবে, কিন্তু করবে তো নিশ্চয়ই। কনসিস্টেন্টলি ধরে যেতে হবে।
Impressive. So parental counseling is also a part of dentistry, because parents, they come with lot of anxiety, lot of inhibitions, lot of pre-assumptions. So even breaking that,
I would say that is a form of desensitization, which we are doing to the parents as well as the children. Because if the child is not letting the brush in, how will they let a dental mirror in? So that is the primary part. So that is why, as we had mentioned in our previous conversation, how important it is regular dental visits. That is when, because a dental clinic has aerators, which is a whistle, which is a drill from where water is coming out. So for that, you take the child who is already in pain, who is already anxious, not able to communicate, not sitting on the dental chair. How do we expect the child will take an aerator? So that is why we say early interventions and regular dental visits every 6 months. So first and foremost, it will, again I said, burden of the care. That child, I can vouch for that, will not have a dental caries. Why dental caries are more? Because of their food restrictive habits. So they will not have, because the parents are already empowered how to take care of their teeth and how important it is. That's how it is. It's very close to my heart. So I think I spoke a lot about it.
It really came out, ma'am. And still, awareness is spreading in cities. But we have seen children, they are coming from suburban areas where the parents, they force the child, like, korbi na mane, you have to do. And the kind of trauma that the child face, we can very well relate to that. So ma'am, with this, we move into a quick true and false round. So we will be giving you a series of statements. which are centered around certain myths, assumptions, or realities regarding dental care and autism. So you will have to, ma'am, say whether it's true or false, and you may elaborate where required.
Okay.
Okay, ma'am? So brushing twice a day is enough for children with autism, regardless of diet or sensory issues.
It's false. Brushing twice a day is definitely necessary, but it is not sufficient. Again, it is tailored to every and customized to every children. Brushing included after every meal, that is after breakfast, after lunch, and after dinner, will help our children. Why? Because they are hypersensitive. I see children who are not even able to spit, who are not able to brush. They are not able to move the food from one side to another. So how will they clean the tooth? So that there is lot of food inside the mouth. They can twice, not sufficient, after every meal. Also, if the child can, mouthwash can be incorporated. Tongue cleaning should also be incorporated.
And ma'am, that is true for all children as well.
That is true for all children, but other children, they can swiss and spit. However, children with autism, they have difficulty with swishing as well as spitting, movement of the tongue. They have mouth breathing. They have sleep apnea. Many of the children on autism we are seeing with sleep apnea, behavioral issues. So when they are unable to chew the food, which are hard, sticky, it's a soft and sticky. Regular children, they are like who are not like in the neurodiverse range, they are chewing on the food. So when we are chewing on the food is moving from one side to another. There is saliva, but children with autism, they're very restrictive. Most of them who are non-verbal, they are on soft, sticky diet. So those are getting stick to their tooth. They are not coming out. I have seen children who's 11 years of age, I cannot see the permanent molars. Permanent molars are not visible. Why? Because the parents are brushing twice, but permanent molars are not visible কারণ বাচ্চাটা তো মুখে টুথব্রাশ ঢোকাতেই দিচ্ছে না। তো দুবার করছি বা একবার করছি কি করে হবে? খাবারটা জমে 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 ওখানে টাটার ফর্মেশন হয়ে গেছে। তখন চিন্তা করুন তো ওই বাচ্চা যে নন ভার্বাল, হু ইজ ভেরি মাচ অ্যাংশিয়াস, ওকে যদি বলা হয় যে তুমি ডেন্টাল ক্লিনিকে এবার তোমাকে পরিষ্কার করতে হবে, তোমার ইয়োর ফার্স্ট ডেন্টাল এক্সপোজার অ্যাট 11 years of age, where your molars are not visible. How will the molars stay? The molars are the one who are staying. The permanent molars I'm talking about, they die when we die. They are the primary chewing, tooth. So if we are not chewing, how are we speaking? Because here, the speech is from here. They have tongue tie as well. So that is, I think I elaborated a lot. Not twice, 3 times should be.
It should be done.
It should be done. Yes.
Okay. So moving to the next statement, sedation dentistry should be avoided in children with special healthcare needs.
Again, a myth. Sedation dentistry is, if it is done in a controlled environment by somebody who has an experience in it, is a boon to the management of behavioral management of children, especially for children with autism, because children with autism has a lot of anxiety. Novelty is always a form of anxiety to them. So it is a very beautiful management strategy of dental problem in case of children. In dental clinics, we do 3 forms of dentistry. We do 3 forms of sedation: minimal, moderate, and severe. So minimal form of sedation is nitrous oxide, which we call happy gas. Okay. So nitrous oxide, the minimal form of sedation, is regularly done in dental clinics by experienced practitioner. We also have in our little tooth, which is a first sensory sensitive dental clinic, exclusive pediatric dental clinic, which is also sensory sensitive in West Bengal. We have nitrous oxide in our clinic, which we are doing. Why are we doing? We are doing it just to alleviate the anxiety of the children. So the children, when they are opening their mouth, they are in a very relaxed state. And also there is minimal and moderate and deep sedation. Deep sedation is general anesthesia, which should be done in the presence of an anesthesiologist in a hospital setup.
Okay.
So sedation is a very important tool for management of children with autism.
Okay. All dental tools and setups are equally suitable for children with sensory sensitivities.
This is again a myth, I would say, and it is, as I have mentioned earlier as well, it is not the setup, but it is how we are treating the children that also matters a lot. So sensory integrations has to be taken care of in the dental clinics, and that starts with very small changes. We can use small dental mirrors. Dental mirror usually in the dental clinics are very big, so we can use a small dental mirrors. The suction which we use, which we take out the saliva, so that's the isolation mechanism. Suction has a lot of noise. We can introduce a small suction for the children, and also small lights and all, how we can change the flooring of the dental clinic. We can have a clinic which does not have very like smelly, because dental clinics eventually, when we treat patients, they become smelly. Because why? Because like lot of patients are coming, lot of materials are there, so first appointment can be given to those children. So these are small changes with, as I mentioned, nitrous oxide and modifications in the dental lights, and all those things can be done for the children with autism. Also, we provide videos to the parents of the how a dental clinic looks, so that the child knows, and previously he is desensitized to the dental team. So these changes can be done.
So videos are also sent.
Yes, videos are also sent.
Okay.
And the first appointment, if we know what is the treatment that to be done, we also send the erotor pictures. They can sometimes write social stories, and then we train them to do that. The assistants and all do that.
Great. So it's a total scientific approach. Delayed speech or motor skills in autism have no connection with oral hygiene routines.
It is a very interconnected approach. It is not true. It has a lot to do with oral hygiene routines. Delayed speech means hypotonia in the muscle. So since there is hypotonia in the muscle, there is difficulty in brushing. There is difficulty in spitting. There is difficulty in eating. There is difficulty in chewing. So the food is getting stuck. The child is unable to brush. The child is already in soft, sticky diet. So can you see how ripple effect is getting created over here? The child is hyposensitive, okay? So there is laxity of muscle, and then the food, he is very restrictive on that, eating only on soft, sticky, sugary carbohydrates, which are not moving from one place to another, getting plaque accumulation, and getting further movement of the tongue is a problem. So that is why the child has speech delay as well, okay? So if oral hygiene practices are improved, so speech is also improved, because the child is now brushing, there is a massage to the gums, there is cleaning of the mouth, okay? So speech articulation also comes. I have seen patients who, after getting their cleaning done or better oral hygiene practices, they are doing better with their speech therapy as well. There is something in autism known as mouth breathing. So mouth breathing, why does it happen? Mouth breathing and oral hygiene practices, that is all related. So if they come, we tell them to close their mouth. We tell them how tongue has to be placed, where tongue has to be placed. That has a lot to do with speech issues as well. We tell them if the child has a tongue tie. Tongue tie is nothing but when the tongue is restricted, the child is not able to speak properly. So tongue tie is released, the speech. I'm not telling for all children. This is tailored and individualized for every children. That does not go a one-stop solution, but this is how they are interrelated. So oral hygiene has a lot to do with like the sensory issues. They have a lot to do with the oral hygiene practices. If they know how to swish, spit, their speech also improves. So it's all interrelated. In turn, they are related to each other.
So everything is again interdisciplinary.
Yes, it is interdisciplinary, and it is like, I would say, a guitar, in where one string, if it is not playing properly, there is no tone to the guitar. So we have to touch the exact which string we are working on, including oral health. That's a very important part.
That is the most important part now.
Because there where everything starts.
Right.
Our speech starts, our digestion starts. So that's the starting point.
Right. So, ma'am, last but not the least, regular dental visits can sometimes help regulate other behavioral routines in children with autism.
Very true. I have seen that in my practice of past 15 years. I've been seeing that because there are some parents who come to us regularly. Who has started coming at when the child's, according to American Academy of Pediatric Dentistry, the child should first visit a dental clinic when the child is only 1 year of age. So I have seen parents who are coming, the child 16 months of age, and now the child's habits, all the behavioral issues have also improved. How? Because when they are coming to the dental clinic, they are sitting properly. They are knowing how to behave, how to sit in a waiting area. So it's a very complex and overwhelming situation. So they are knowing how to behave. From there, their school habits have improved because they have been coming regularly. And also there we have diagnosed how to brush. So they themselves are brushing at the age of 4 years. Okay, a non-verbal child who is brushing at the age of 4 years by themselves because it was already introduced. And food issues have also like taken care of. Chewing on, not very hard, but yes, moving from one place to another through oromotor exercises. So these can help them in their long run, and behavioral issues as well. They don't have a behavior. I will not say don't have. There are other disciplinary and behavioral issues as well. But what I am trying to tell is plays an important part.
Yes, so Dr. Palit, it has been an eye-opening, conversation for all of us. So many insights, so many multidimensional aspects of oral care and hygiene for individuals in the spectrum. So I hope the viewers out there, even they have enjoyed watching this video. So for parents and others, if you feel that this video, it is relevant to you, it resonates with your current state and emotion, please do feel free to like, subscribe our video channel. And there are many more videos that are popping in the screen. Please go and watch those videos. It will be of great help to you.